Hello, ladies and gentlemen. Today we'll be discussing the case study on in vivo versus in vitro degradation of controlled release polymers for intracranial surgical therapy. Now, the development of controlled release polymers has been a novel approach in the treatment of surgical diseases. We have implantable polymers that are used for drug delivery purposes during the treatment of gliomas, Parkinson's disease, Alzheimer's, etc. There's a lot of them. Further, in many of these cases, substance delivery is actually enhanced by implantation of the polymer directly at the surgical site. An example could be anti-neoplastic drugs that are used to treat cancer. They harm normal cells on the way, and this new approach could actually increase efficacy and reduce systemic exposure. So further working off of that, the current study seeks to determine whether slowed polymer degradation in vivo is due to the intrinsic in vivo conditions or due to the conditions of surgical implantation. The study also seeks to document the expected time it took for in vivo polymer degradation. We hypothesized that various intrinsic parameters might affect polymer degradation in the setting, especially in the case of intraoperative brain tumor therapy, and experiments were designed to test these in vivo parameters. So a polymer wafer was surgically implanted into the brain of each animal, in our case being rats. Residual polymers were harvested at varying times for chromatographic analysis. In vitro effects of pH, mixing, and water availability on degradation were also studied. Also, the results of in vitro and in vivo studies were compared to understand the behavior of polymers within a clinical setting. We were basically evaluating for four main variables. The first one being the influence of the brain tissue itself. The second would be the influence of a chemotherapeutic drug on that brain tissue. Followed by the influence of a growing tumor, which has possibilities of recurring clinically within 2 centimeters of the initial tumor margin. And lastly, we were testing for the influence of oxidized regenerated cellulose, which in other common man work
Rats were used as in vivo testing subjects divided into 4 groups. Group 1 received the empty polymer. Group 2 received the polymer 20% loaded with BCNU, carmustine therapeutic agent. Group 3 received the polymer 20% loaded with BCNU 4 days after 9L glioblastoma implantation. Group 4 received the empty polymer and Surgicel, a hemostatic agent of oxidized cellulose polymer. The in vivo protocol was as follows. PCPP-SA polymer wafers were first sterilized with ultraviolet radiation, rats sedated via IP injection of Xylocat, calvaria exposed via mid-sagittal incision, burr hole drilled in calvaria to access the dura, then forceps were used, dura nicked, polymer inserted vertically, 9L glioblastoma implant extracted and implanted on the same day, tumor grown for 4 days prior to polymer implantation within it. In vitro protocol consisted of empty polymer wafers buffered in phosphate buffer solution. Solution was kept on rotator. pH-dependent buffer solutions were run with pH 6.4, 4 and 2 buffers. Sample preparation involved dissolving polymer remnants from rat brain in pH 7.4 phosphate buffer solution. Potassium phosphate buffer was used for polymer wafers for group 2. Solution was pre-filtered and HPLC was performed. Levels of SA and CPP compared and used to determine amount of polymer degradation for in vivo and in vitro studies. Chromatography procedure separations were performed at ambient temperatures. HPLC preceded by PRP1 cartridge guard column gradient system with flow rate 1.7 milliliters per minute employed. Ratio of 1684 maintained for 4 minutes, increased to 3070 and maintained for 3 minutes, then back to 1684 for 7 minutes. Wavelengths of 210 and 246 nanometers were used.
Here are the results for empty polymer degradation. We can see on the graph on the x-axis is the percent of sebacic acid and carboxyphenoxypropane erosion with respect to time. The polymer wafers degraded slightly more slowly in the rat brain than in agitated in vitro buffer solutions. A marked lag was observed in vivo CPP degradation profile for about a week before any significant erosion was observed. In the rat brain, the polymer degraded completely and no polymer remnants were found by 6 weeks. The results for BCNU-loaded polymer degradations are here. The graph shows the BCNU degradation in terms of days. The one in dot is sebacic acid and the square is in CPP. Polymers that were 20% BCNU-loaded also degraded slightly more slowly in VIM than in vitro at the pH of 7.4. Surprisingly, the erosion pattern for both monomers were similar to those observed for empty polymer wafers. For empty polymer degradation with Surgicel wrap, Wafers were pre-wrapped in low pH hemostatic agent. They were allowed to degrade for various times in the rat brain before removing the remnants. The remnants were analyzed at 7 different time intervals, beginning at 1 week after implantation. In every case, polymer degradation was more than 90% complete at the time of removal. The figure on the left shows wafers of PCC assay which were allowed to erode into sodium phosphate buffer solution with 2 different amounts of monomer saturation in the buffer solution. And the figure on the right shows the pH dependence of polymer wafers which were allowed to degrade in buffer solutions of pH of 7.4, 6.4, 4, and 2. Both CPP and SA eroded from the wafer significantly more slowly with decreasing pH. The figure on the right is for rotational speed dependence, where the wafers were allowed to dissolve in pH of 7.4 in the phosphate buffer solution at 2 different rotational speeds for agitation. The rat brains harvested from the blank polymer implantations were placed in 10% neutral formalin and preserved for histology. Figure on the right shows the results for correlation with inflammation in CPP degradation. The time at which CPP degradation markedly increased seemed to coincide with the time at which inflammatory processes dissipated.
In all cases, polymer wafers completely degrade within 6 to 8 weeks. These findings are consistent with other studies where radiologic images indicate polymer degradation generally within 2 months. Initial degradation of the polymer wafers occurred more slowly in the rat brain than in vitro at pH 7.4. This phenomenon was found under conditions where the polymer was loaded with BCNU and implanting the drug-loaded polymer in the presence of 9L gliosarcoma. The slowing of degradation was only found within the first week of implantation and did not change the ultimate time by which the polymer degraded. The results suggest that drug loading, the presence of 9L gliosarcoma, and the use of Surgicel do not significantly affect long-term polymer erosion rates. CPP and SA were found to erode more slowly with increased acidity. The data collected, however, suggests that the brain's buffering capacity is capable of maintaining local pH within a narrow range, keeping polymer degradation rates unaffected. Current studies suggest the intrinsic degradation process of the polymer occurs in a predictable manner in vivo. Therefore, it is likely that extrinsic factors have an important role in sometimes affecting polymer performance in the clinical setting.
And finally, the conclusion of the study is that the polymer does degrade appropriately in vivo. But more investigation is required to determine solubility and water availability conditions in the brain, particularly with regard to the amount of polymer loading permissible in a small tumor resection site. And thank you for your time.